Yes, perfect.
All right, I'm going to start sharing my screen here then. All right, can everybody see my screen?
Yep.
Great. Well, good afternoon. Thanks everybody for joining us today for our Big Sky Care Connects webinar for Montana Primary Care Association. We are going to record this session so we can make it available to those that couldn't attend. And I think I've written down everybody in the audience, so thank you for joining us. My name is Young Huff, and I am one of the outreach coordinators at Big Sky Care Connect. On the slide here is the agenda that we have for today's webinar. I have with me today Becky Atkinson, who will go over the privacy and security section with you, and Jeanette Polacek, who will provide you with a live demo of our HIE. If everybody can keep their lines muted throughout the presentation, that would be great, but feel free to unmute if you have a question, or feel free to use the chat box. So before we get started, I have some exciting news. BSCC just hired a CEO. His name is Nick Dawson, and he is with us here today. So I'm going to turn the time over to Nick to say a few words.
Thanks, Young, and good morning, or good afternoon, everyone, excuse me. It's been one of those days where everything's kind of run together, but I'm particularly excited to be here with you all today for a number of reasons, one of which is this is one of the first external conversations I've had since joining the organization a little less than 2 weeks ago, and I'm just particularly thrilled to make this a conversation as much as anything. And I'm excited to hear your reactions to what we share today, both in real time and then any questions or thoughts you might have after the fact. And I'll share just a little bit of background as a way of teeing up what I mean by a dialogue in this context. Before joining Big Sky Care Connect, I've had a background in starting and leading innovation teams inside of health systems. So I was the head of innovation for Kaiser Permanente, for Johns Hopkins, for the School of Medicine at Stanford, and then worked with three of the most recent White House administrations. And a constant theme in my work has always been building things by starting from listening to the needs of people. And in healthcare, that's the needs of nurses, it's the needs of doctors, it's the needs of patients and caregivers. And it's asking the question of, how do you experience something? What are the pain points, and what could we do differently that would solve those things for you? And I could tell stories for hours about how we've done that, particularly some really interesting projects around primary care, where we focused on reducing mental fatigue and burnout that I think physicians everywhere in this country are tragically feeling more and more of. And I could talk about that kind of thing for hours. But in this context, what I want to tee up is a similar conversation of, as we think about this health information exchange, as we think about that as a platform, as a kind of a black box of technology and problem solving capabilities, in addition to the things you're going to hear today about some use cases and some benefits in workflow and quality of care and efficiency, I'm really interested in what other challenges you're facing, and for us to think creatively together about how do we use this as a platform to solve those challenges. And I'm saying that because I'm holding this really big vision that we will take advantage of this HIE as a platform for all of Montana, and we will use it to make Montana the healthiest state in the country. And that may sound lofty, but I'm into big goals, and I'm into really big aspirations. And I think it's a thing that is uniquely achievable for a number of reasons. But one of them is we have a chance to do what some people in the tech world sometimes refer to as skipping the landline. And you may know that analogy. It's the idea that in a lot of countries, they never put down expensive landline telephones. And so when cell phones and wireless internet came out, they adopted them more quickly and more creatively because they didn't have this existing infrastructure. And so we have this opportunity in Montana to learn from what every other state and every other HIE and every other kind of health innovation ecosystem has done, and to leapfrog it in some meaningful way. And so I'm really sincere when I say that what I hope we do together is not just build the basic interoperability and interconnectivity that HIEs deliver everywhere, but it's to build a platform where we can really truly make Montana the healthiest state in the country. And I could talk about that for hours and hours as well. So with that big intro in mind, let me pipe down, go into listening mode with all of you all, and then really tee up this idea of let's make this a conversation that starts with what are your most pressing needs and what else can we do in addition to some of the things you'll hear from us today. So excited to be here. And Anjan, I'm going to turn this right back over to you.
Great. Thank you so much for that great message, Nick. Well, before we begin, I just wanted to say thank you to Montana Primary Care Association for their support of BSCC. A special thanks to Cindy and Leslie for all of the assistance and for giving us the opportunity to talk to all of you guys today. I'm sure that most of you have heard about BSCC by now, but we were established in 2018 as a nonprofit organization to establish and operate Montana's statewide HIE, and it was endorsed by Governor Bullock. We have board of directors with diverse representation made up of high-level decision makers from all types of Montana healthcare organizations and include representation from providers, patients, payers, and businesses. We also have advisory committee structure with input from experts in the field. BSCC has partnered with InterSystems, who is the global leader in this field and best-in-class award winner for interoperability platform last year. So what our hope is to go transform the way we exchange health information with the healthcare providers in the state of Montana. We're hoping to provide you with a secure, seamless communication with access to comprehensive patient information and to connect you to various members of the healthcare team to allow for a more multidisciplinary and patient-centric approach to healthcare. BSCC will allow you to have vital patient information at the point of care. Now, I know that all of you guys are experts in quadruple aim, so I won't have to go into the detail about those goals, but really ultimately, our goal is to help you in achieving those quadruple aim goals. There's a lot of evidence on the benefits of statewide HIEs, and more data is being shared to quantify some of the value propositions. Healthcare facilities that have been participating in their state or regional HIEs have realized better outcomes with reductions in readmission rates, decrease in duplicative services, increase in revenue from better documentation, and cost savings from avoiding adverse events, just to name a few. So our hope is that we can be of assistance to you in realizing some of these benefits through our statewide HIE. We're excited to announce that BSCC went live with our InterSystems Health Share HIE platform on December 18th. So we have built the foundation that provides the integration tools and the privacy and security measures. And now we're working diligently to bring in data from connected hospitals and clinics. So as you can see on the slide, we currently have 4 hospitals contributing data. We have ADT messages coming in with demographics, allergies, diagnoses, procedures, and encounter information, as well as radiology reports from Billings Clinic. And we're actively working on getting imaging and transcription data as well. We also have doctor first medication history coming into our portal, and we're also offering ED alerts for hospitals. There's 3 different ways you can access the HIE. One is single sign-on, which makes it really easy for your providers to access the patient information right from their EHR. So this feature automatically signs the user into the HIE, finds the right patient record, and opens it all in one click. So they don't have to remember another login and password, and we know that they all like that. We can also accommodate direct query, which will actually pull a CCDA document right in from the HIE into the EHR. And you will need to verify with your EHR vendor that they can accommodate these features, but if they can, this is something that we can make it available to you. And the third option is the provider portal access through the web. And Jeanette will go more into detail about this when she shows you the demo. So here's a list of all healthcare facilities that have signed on so far to connect to BSCC. As of today, we have 48 signed, 25 of them being hospitals and 3 of them being FQHCs and members of MPCA. So I've got those highlighted in blue for you. I'll let you take a look at those, and I can share these slides with you as well if you like. So what's up next for Montana statewide HIE? Well, we're busy onboarding all of those participants who have signed up, so we'll have more data coming into our system. Our outreach coordinators are still busy outreaching to many more facilities to get them to sign up. In the near future, we're going to have 3 years worth of patient data coming in from Medicaid. That includes medications, diagnoses, and procedures from 700,000 patients. We've also connected to eHealth Exchange, which will help us to get connected to other HIEs and other initiatives like the patient-centered data at home for the Western region, and in the future, access to VA and DoD information. So we are also working on patient event notifications. This will be a great value to FQHCs in improving transitions of care. So what this tool will do is provide real-time notifications for ED or hospital admission, discharge, or transfers of your patients to whoever subscribes to this functionality. So you can have your case managers or your providers sign up for this feature and they would get alerts in real time. BSCC is also reviewing RFPs for data analytics and quality metrics solutions to add to the HIE as our core services. And then we're also exploring image exchange and care management. So any questions so far before we dive into the privacy and security?
Young, this is Rebecca.
Hi.
Not to put you on the spot, but could you elaborate a little bit about what you mean by care management?
You know, I'm probably not the best person to talk about that because I haven't been involved in the procurement process, but Jeanette or Becky? Okay, there's Jeanette nodding her head. Go ahead, Jeanette.
Yeah, care management would be a tool that would allow you to coordinate the care of a patient who is receiving care from a multidisciplinary team across multiple health systems. So if your organization provides like transition care services to your community and you're working with providers and other practitioners that do not have access to your EMR, this tool would allow you to coordinate the care of that patient and do more detailed documentation than we have in the base HIE.
Does that answer your questions?
Yes, it leads to other questions, but I won't bog us down. Maybe I'll reach out to Jeanette.
Yeah,
offline.
absolutely. Please do.
Yeah, thank you. Any other questions? All righty. And we will move on to the next section. I'm going to introduce you to Becky Atkinson, who is BSCC's clinical business analyst, and she will cover this topic for us.
Thanks, Young. So one of the things we want to make sure of at Big Sky Care Connect is that protected health information is truly protected. And so as Young mentioned, we use InterSystems as our platform, and they are high trust certified, which means they have to comply with HIPAA standards. So all of the client data within the HIE is encrypted while it's stored in the database, but also when it's transmitted between participants and other organizations. The highly sensitive data, we have different roles that protect that. So when we talk about highly sensitive data, we're referring to 42 CFR or behavioral health data, and also substance use disorder, HIV, and sexually transmitted disease data, which is parsed out using ICD-10, CPT, FLOINCs, and SNOMEDs. Next slide, please. So we have restricted access, and there's also permission that is granted based on facility roles. And there's also the ability to break the glass. So the three roles that we currently have are clinician with 42 CFR access or ability to see that sensitive data, and then clinician without 42 CFR access and support staff. With each access, the data would be logged to show who logged in to view the patient information. But as clinicians break the glass, it would require that they document a reason, and it would have the date and time stored in an audit log, which Big Sky Care Connect would be able to run for participants as they needed. The audit logs track all the break the glass activity, but also any activity that happens within the HIE. There would be a privacy officer role who would be able to monitor your facilities and also provide you with those reports. Next slide, please. Big Sky Care Connect follows an opt-out model. There isn't necessarily legislation that requires Montana to use an opt-in or opt-out model, and so Big Sky Care Connect chose to use the opt-out model, which allows patient information to flow into the HIE unless they opt out. Patients are able to opt out at any time, and the methods that can be used is either through your provider by sending the ADT messages that have it flagged that the patient has opted out, or directly through the Big Sky Care Connect website, where the patient can complete an online form or mail in a completed form to set them as opted out. Clinicians with proper access can break the glass during emergency situations to access the patient information if they would need it. But like I said, all of that information is logged, and they have to put a reason for the access in the HIE. Patients are able to opt back in if they opted out using the same methods that I just described. And the other important thing to know is that because we use an opt-out model, the patient information is never deleted. The patient information is hidden when the patient has a status of opted out. Next slide. And so now I'm going to turn it over to Jeanette, who is our expert with the HIE, and she's going to do a demo for you.
Okay, let me share my screen. All right, can everyone see my login page? I'm going to say yes. Okay, so I'm
Actually,
going to, what?
I don't think we are. I think we're seeing maybe a second desktop.
Oh, okay. How about now?
That's better.
Okay, great. All right, so this is actually a production environment, and I'm going to log in, and the way we've set this up in production, we actually have set up some test patients and a test facility. So the information, the patient record that I'm going to show you today looks like a real patient record, but it's actually not. So here, when you first log into the system, you come to the patient search screen, and you can either search by facility and then the associated medical record number, or you can put in the patient's first name, last name, and then some additional identifying information such as demographics, gender, and date of birth to further refine your search. I'm going to go ahead and put in the medical record number, so we're not pulling up any patients that we don't want to see. So when I put in the information, you can see here I get a direct hit. A weighted match of 1,000 means an exact match. Now from this screen, I can open this up further, and I can see for this patient all the medical record numbers associated with this patient. Because this patient is a test patient, we only have one medical record number associated with him. I can also get an indication of the kind of data that's available for this patient before I even enter the patient record. So here, these icons depict different data types that are available for this patient. And if I click on any one of those icons, I'll get a list of the information that's available for this patient in the patient record. Now, when I click on the patient's name, I pull up the patient chart. This is set up like you would see any other typical EMR system. I've got my basic demographics up here at the top. Along here, along the side, I have a navigation tool that allows me to navigate to different sections of the HIE record. Over here on the far right upper corner, I have some additional icons. I can click on them and get some additional information about the patient. This patient has allergies. I can click on here and go to the allergy screen. Patient demographics, I can click on that, and I can get the details on the demographic information that's available for this patient. I can also click here on MRNs. Again, I'll get all the MRNs associated with this patient. There is one additional identifier that's displayed here. This is the master patient index ID. This is a number that's assigned by Big Sky through our master patient index, and that allows us to link all the medical record numbers together. So no matter which medical record and facility you search on, you'll get the full HIE record of all the information that's available for this patient. And if you guys have any questions, please shout them out or put them in the chat. All right, so when I first come onto the screen, I get what's called a clinical summary. And what this is the top 5 entries, most recent entries for critical data, if you just want to get a quick overview of what's going on with this patient. So I get diagnoses, lab results, allergies, diagnostics, medications, and documents. Now you'll notice that some of these don't have information. The way that we've set up these test patients is that we only reflect the data that is currently available in the solution. So right now, as Ah Young said, we've got information coming from 4 different facilities that includes what's called ADT information, which is basically sending information about demographics, which I already showed you. And then depending on the capability of your EMR, we would also get information about diagnoses, procedures, allergies, and encounters. Diagnostic studies are right now just coming from Billings Clinic, and those are radiology reports. And then medications is coming from a data source called Dr. First. If some of you don't know what Dr. First is, it's a major clearinghouse of medication information about patients. The data comes from SureScripts, it comes from pharmacies, it comes from pharmacy claims data. So for information that we have available, that data is displayed here in the HIE, and I'll talk a little bit more about that in a minute. So when I close the clinical summary, I get all the different sections that I can navigate to. The blue bar here along the left indicates that there is data available for this patient in that section. So for instance, if I go in here to encounters, this shows me all the encounters that I have available for the patient across all the facilities that are contributing data to the HIE. It's all organized into one section that's displayed here. Each of these different sections has a free text search if I just want to do a free text search. And it also has some short sort options that I'll cover when we get to medications. Usually there's this 3 dot icon here at the very end, and I can click on that to get additional information about the patient. This is giving me some information about insurance that's associated with this encounter. If I go to procedures, again, I get a list of procedures. For diagnostic studies, what I get is the list of the studies, and then I have a link for each study, which I can click on, and then I get the full report that's associated with this study. These are not, we don't have images yet. What we do have are the reports from the images. Okay. And then for medications, again, this is coming from Dr. First. Eventually, we'll be getting data, as Ah Young mentioned, from Medicaid. We have that in our test environment right now, and we will be getting medications, diagnoses, and procedures that we extract from the Medicaid claims data that we have in the solution. But right now, all of our source is from Dr. First. And the way that the information is populated into the HIE from Dr. First is every 4 hours, when I open this patient record, sorry, I'm stumbling on my words here. When I open this patient record, if a query has not been sent to Dr. First in the last 4 hours, then a query will be launched and the data will be refreshed. And you might get a little sign up here at the top that says it's refreshing, and then it'll give you the opportunity to refresh once it's done. So these are fairly comprehensive medication lists, and for complex case patients, they can get very large. So this is where the sort options will be of great value. So what I can do for medications is I can first do the main sort on the medication name, and then I can go in and I can do a secondary sorts on date, so that within each medication, I can look to see what the fill patterns are for this patient really quickly, and I can get a quick idea of the patient's compliance for a particular medication. All right. the other thing I want to show you is the HIE has the ability to generate a patient summary. So here I have a summary of all the information that's available for this patient in the HIE. I can look at it in different ways. I can look at the actual continuity of care format. I can look at it in HTML or as a PDF. And then I can do the regular patient summary report versus the expanded report. And if I have direct secure messaging attached to my Big Sky user account, then I can send this information to any other practitioner that has a direct secure messaging account. If I don't have that set up, I can download the summary onto my desktop and then use whatever secure method you have available to send information to different providers. And it's as simple as that. Does anyone have any questions?
We did have a question come in from Coy that said, what EMRs are currently compatible for BSCC to exchange data with? And I replied that we can accommodate any EMR that is 2015 cert. Is that correct, Jeanette?
2015
cert, you know, unless they're really old type of EMR.
Oh, yes. Did you say
Yeah.
2015?
Yeah, 2015
Yeah,
cert.
right. That's absolutely right. And InterSystems is, as Ayung said, they're in major HIEs across the country. It is most likely any EMR that is available they have already worked with in the past. Not necessarily here at Big Sky, but they have the expertise to bring to the table for most any EMR that we would encounter.
Yep, and then Leslie commented that there is a contract in the works between BSCC and ECW for a hub that would host the connections to the HIE. Riverstone will pilot the connection once the contract is in place, yes. And the latest that I have on that, we just have some edits going between legal counsel between BSCC and ECW. So as soon as that gets executed, then we can begin to work with Riverstone on the hub model. Any other questions?
I want to show them one other thing, Ayung.
Sounds good.
So now I'm going to hop over to our, this is actually the test environment. And I just want to show you what we're working on in terms of highly sensitive data. So let me just sign into this environment. Again, this is our test environment, but we do have live patient data in here as well. So what I'm going to do is I'm going to try to find a patient that is associated with a 42 CFR designated facility. So I'm going to select that facility. I'm going to put in the medical record number. Now, when I search on that patient, it's going to say some records have been filtered due to consent. So because I am a clinician that has access to highly sensitive data, I will get this message. If I was someone who didn't have access to highly sensitive information, I wouldn't even get this message. It would just say no records found. But because I do have access, this tells me that I need to go back to my patient search. And now I still have my search criteria in here. And what I can click this override button down here, and then I can put in information about the consent policy. So it's authorized by the user. The reason I'm doing it is, I don't know, like annual checkup or something, whatever. And then I'd say what kind, and it's verbal. And then I can go ahead and search. And now you can see I found this patient. And when I click on this patient record, we'll get the warning up here that tells us this is 42 CFR data. So this data is being driven by the facility code. So this is information that's coming from a 42 CFR designated facility. So all information coming from that facility would have to be, you would have to break this seal in order to get access to that data. And again, you would have to have the right user role to get access to that data. We're also setting up filters that will filter data, sensitive data based on code sets. So we've developed a sensitive data code set for ICD-9, CPT, SNOMED, LOINC, CPT, all of those. So that is something that we're working on as well. Any questions about that? Okay, then I'm done.
Thank you, Jeanette. All right, I'm going to share my screen again. All right, can everybody see my screen? Great. We'll just briefly go over the onboarding process. So you, if you decide to join BSCC. So if you're interested in joining, we just need an application and a participation agreement from you. The PA, the participation agreement, was vetted by the BSCC board, committee members, and a large group of interested stakeholders that included a mix of small and large hospitals, clinics, and payers in order to capture the comprehensive needs of all Montana participants. So I think they worked on this over 6 months period. It's very comprehensive. So we cannot amend to this or make any changes because it needs to be same for all participants. PA is also inclusive of the Business Associate Agreement, the BAA, which supplements the PA, and it permits the exchange of information from cover entities to BSCC that's consistent with HIPAA. We can also offer you our operating policies as they are referenced in the PA. So once you sign on, by signing the PA-BAA, you will work with your outreach coordinator to complete the intake assessment. And this is just a form that you fill out to provide us with some additional information about your facilities. Tells us the key people involved in the project, your training preferences, and connectivity goals. And then once we complete that, your outreach coordinator will introduce you to the technical onboarding analyst that you'll be working with. They'll get you and your EHR vendor or InterSystems rep all together to hold a technical discovery session. And at the session, we'll kind of scope out your project to decide, which interfaces you're going to work with. Once we have all that figured out, you will start onboarding sessions weekly. It's just a 30-minute or less meeting once a week. And then you'll establish connectivity, start sending test messages. You'll go through testing and validation sessions, and you can go live with each of the interfaces. Now, BSCC can provide access to your users anytime that you want since we're live with the system. So you can choose to do this as soon as you sign up or wait until you go live with the data. It's totally up to you. And the access just requires you to fill out what we call an authorized user agreement for each of your users. And those are shared with the outreach coordinator. And then we'll get back to you a login and password information from our help desk. And then your outreach coordinator will also coordinate HIE training for all of your users. These are offered through Zoom. They're about an hour and a half in length, and we offer several sessions every week. And then as part of our core services, we also provide direct secure messaging through SMS. So if this is something that you don't currently have, we can provide this for you as well. For those technical people, here's some information on some of the connectivity. We can do the secure connection through either VPN or HTTPS. That's your preference, but I think majority of the people do VPN. We can do the data exchange through HL7, a lot of different versions that's on the slide here, as well as the CCD exchange. And I have listed here for you the different types of interfaces that we can accept from your facility. Now, we understand some of our participants lack fiscal and human resources to achieve this connection, and we don't want that to be a barrier to accessing this statewide HIE. So we've created a program to provide financial assistance, and it's called Interoperability Assistance Program, IAP for short. And through this program, you can be reimbursed for any out-of-pocket expenses related to the project. So for example, if your EHR vendor charges you an amount for each of those interfaces, you can include that, or you can even include some of your staff's time involved in the project. We'll do up to $35,000 related to the outbound interfaces, and then up to $15,000 for either single sign-on or direct query project. And you'll be eligible to apply for this as soon as you have a signed PABAA with us. The applications are reviewed in order that they are received, and funds are granted until the funding source is depleted. So there's definitely an advantage to signing on earlier rather than later. Reimbursement is available to you once the work is completed and you provide us with proof of payment. And the only caveat is that you do have to be connected to BSCC by end of September, as this funding sunsets at the end of September. Any questions on that? Okay. As part of our services, we're also offering change management consulting services, as we recognize that it can be difficult for some organizations. We want to provide leaders with tools to navigate change and manage transitions to improve outcomes. So we offer up to 4 hours of free consulting services by Kurt Swenson from FutureSync as part of our onboarding. Kurt can go through all the details with you. He can work with you to find out what your needs are and cater a program just for your facility. He's fantastic to work with, so I hope you take advantage of this great service. And here's a list of some of the examples of the services that he can offer to you. All right, that's what we had to share with you. So now we should have some time to open it up to questions and maybe have those conversations that Nick brought up. So I will just stop sharing and open up the floor for discussions. Any questions?
I started typing my question, but
Oh.
maybe I'll just say it out loud.
Okay.
It's hard to listen and type at the same time. And I would say it's not hard, it's impossible for me. You know, one piece I noticed on your slide was that there was ED alerts.
Mhm.
Could you talk a little bit more about that? Because one thing that's been surfacing in our organization is, how will we know when one of our patients has, you know, been admitted to a hospital that's also on the HIE? And to my knowledge, we won't at this point.
You sure will, as soon as
Okay.
our event notifications is up and running. So we are actively working on getting that set up, and that is part of our core services. So as soon as that's up and working, Rebecca, you will get alert received in real time anytime your patients are admitted to either hospital ED or hospital inpatient, if they're admitted, discharged, or transferred. Now, what I've been told by the technical team is that message can come to your doorsteps of your EHR. How you consume that and present it to, you know, through your workflow is kind of up to how you work through your EHR vendor. But I think it can be received by either direct secure messaging, or it can be incorporated into your workflow as well. So yes, you will definitely have access to that.
Do you have any, do you have any sense of when that, like, what's your estimate for when that's going to be up and running?
Becky or Jeanette, do you guys have, I think Jennifer might be on here too.
Jennifer, yeah.
Yeah, Jennifer, do you have a sense of when that will be up and running?
I'm sorry, Ayang, can you repeat the question?
Oh, they're asking if we have a timeline for when the event notifications will be up and running.
Oh, thank you, Ayang. So we are working with the HIE technical team and reviewing current functionality and determining what use cases are needed and what to functionality to release quickly. And so we should have direction from that within the next week. And then we will be identifying partners who will want to test that for us. So it should only take, I want to say, at the latest 2 months to get that going, depending on how long it takes us to identify use cases and configuration.
Thank you, Jennifer.
Great, thank you.
Mm-hmm. Any other questions before I turn the time over to Nick?
I was just going to reiterate my prompt from earlier. You know, I know we're talking a lot about the details and the initial value of the HIE, and would certainly love to continue that part of our conversation. But I'd also just like to invite a conversation about some of the biggest, thorniest, and most pressing challenges you all are facing in your practices or kind of in healthcare in Montana in general, and would love to just be able to start to think very boldly and bigly, if those are bigly, I'm not sure if that's a word, boldly, if those are things we can start to think about together. Well, I'll continue. I'll just continue to hold that space, both in our conversations whenever we have them like this in person, but also if anyone would like to reach out, or if we should have a one-on-one conversation, or if you wake up in the middle of the night one night and think, oh, this is a problem or a challenge or an opportunity that I would love a health tech partner to help me solve. Our door and email and phones are always open and available. I'd love to start thinking about those kinds of things in addition to just helping get the state connected and kind of part of our HIE here.
Shauna, did you have a question?
Nick, I guess I was just going to bring up, I mean, I'm not certain it's really a question, but one of the biggest challenges I have right now is just seeing the cost of things that come from my vendor for everything that has to do with the interfacing or the development of reports or the ability to, continue to deliver care and try to make care more efficient. So, we're working on another HL7 regarding our 340B and some of the data reporting for our pharmacies. And every time we have one of those jobs, they're $10, $15, $20,000 to pull some of that stuff together. And so that's one of the biggest struggles I have right now, looking at an annual budget and the revenue that's coming in from patient care, and then truly seeing how big of a picture IT is playing in the role of delivering healthcare right now. So that's one of the big things on my mind. And then the second thing is just, we work with Epic Ocean, and through Care Everywhere for people who are on Epic, you have a great deal of access to a lot of the stuff that would be on an HIE. And I totally get the need for this and understand the big picture piece of this as a physician, knowing how to, access that data and see stuff more real time and not be duplicating services and driving down the cost of healthcare from that standpoint is huge. But from my organization standpoint, I don't know what exactly it's going to get me in order to jump on the HIE. And that's the part that I'm having a little bit of trouble with.
So a couple of things come to mind. First of all, thanks for being willing to initiate the conversation here and for being so candid. I've reflected a number of times over the past years that in healthcare, the dominant cost in healthcare for the longest time was the cost of people involved, and I think that made sense, right? It was people who made a career out of signing up to help other people, and it would make sense that was what healthcare consisted of. And about 15 years ago, we crossed this transition in enterprise healthcare with big hospital systems where IT became the largest cost. And I think that you're experiencing firsthand that we've done that across the entire industry. So now all of a sudden the software that is supposed to make our work, our practice, our communities and our patient experience better is kind of consuming in a lot of ways. And I wish I had a silver bullet for it. I wish I could sit here and say, oh, we can solve that problem overnight. But I think what we can do is be a nonprofit partner to you that can hopefully help solve some of those interface, if not all of those interface issues, a lot more cost-effective way. Right? I think that is one of the big value propositions of a kind of community-led nonprofit HIE. And so I don't want to write checks that our implementation team has to figure out how to cash. But I do know that in most other states, doing exactly what you just described, building those bespoke interfaces and doing it at a much lower cost, or being able to duplicate an interface that we've already built at no cost, is a thing that is the kind of partnership we want to be able to provide. So not a direct response or direct answer, but I'd love to learn a little bit more about what those are as they come up in your practice, and two, figure out a way if we can lessen or completely alleviate that burden for you. To your point about Care Anywhere, I've been the recipient of a Care Anywhere exchange a number of times as my care has moved from Hopkins to KP and a few other organizations. And so I've even seen the screen that providers see when they pull that information over. So I know the value you're speaking of. I think what I'd like to do is just reflect on your comment and have us have an internal conversation. But what I'm hearing is we've got to prove that there is value to you and your practice above and beyond what you would get in Care Anywhere. I have a few ideas of what that would be, but mostly I just want to honor that comment and come back to you, if you're open to it, come back to you with a meaningful response.
Yeah, I think that's great because, you know, what I think of as an interface, I can drill down, you know, specifically to our lab interface. So we have a lab interface with Quest, and when those data points come back into my system, it's a part of my book. It's a part of my EHR. Everything that's through Care Everywhere, or what sounds like what would be through the HIE, is sort of, it's not in my book. It's in my library now, and I can see it, and I can go over and see that this data point is here. Say if I have a interface through the HIE that connects me to LabCorp, which I don't currently have. So now I can see those data points, but they still aren't really a direct interface because it's not in my EHR as the ability for me to now pull data on all of those data points. And so that still takes a person to go back in and enter, edit, and get it as part of my book, you know, my EHR. And so, you know, I really do see the benefit because it's an additional layer that we don't really have right now. But when we take the first comment regarding the cost, it's like, do I jump on this ship now, or is it something that I can just sit back and watch for a little while? Because, you know, the cost of the infrastructure for IT has been so huge for us in these last couple of years. So I would appreciate you guys taking a look at that and helping me to understand better.
Thank
Yep,
you.
absolutely. I'm kind of just taking that in and holding the sentiment there. So let us do exactly that. I think one little comment on my end. One is I really appreciate your analogy to books and libraries. Right? I think that makes a lot of sense. And I think one of the value propositions, right, is making that a bi-directional interface, so that if lab results from a different provider come back on a patient in your panel, or for instance, discharge alerts if somebody in your panel gets discharged and you weren't aware of it, so that you can provide that follow-up care that I think Medicare at least is going to start to mandate here in the next month. I think there's a couple of those things where a bi-directional interface where it does come back into your book could be part of that value proposition. But let us be really intentional in our thought about that in our follow-up to you.
Thank you, Nick and Shauna. I do want to add, if it is something that you are considering and on the fence, there is the funding opportunity timeline does run out in September. So if you want to take advantage of the $50,000 that goes towards that integration project this year, if you wait until next year, then that's not going to be available. So that would be one thing that you can definitely consider. All right.
All young, but they do have to be actually connected by the end of September, right?
Yes.
Like actually have a life. What happens? I'm just speaking what ifs in the world. I've lived in health IT and health center world long enough. What if we don't get those connections established for one reason or another? Not by the fault of the health center.
Sure, and we've had that exact conversation. I've been told that if they sign on prior to July 1st, that's kind of our cutoff deadline, we will do our best to guarantee that you will be completed by end of September and eligible for that reimbursement. So hopefully that helps.
Will you guys share your slides with us so that I could review them at another time too?
Yes, absolutely. I will send that out. I think Leslie probably has all of your contact information, so I'll send it to her to share with all of you. And would you guys be interested in the link to the recording as well? Okay, so we'll get the recording out as well. Any other questions before we wrap up here? No? All right. Well, we really appreciate your time and attention today. I think for most of you, either myself or Becky that will be assigned as your outreach coordinator. So you'll be working with either myself or Becky moving forward. So if any questions come up, or if you need additional information, our contact information is on the last slide of the slide deck that I'll be sending out. So feel free to reach out to us. Otherwise, I really appreciate all of your time, and it was very nice to meet some of you that I haven't met before. So thank you so much.
Thank you, Young and team, and Nick. It was so nice to meet you, even though virtually. So we hope to meet you in person, maybe later in this year. That'd be fantastic. And so, yeah, you all can reach out to the outreach team, or you can reach out to me, and I can help make connections or introductions, or provide you with information as well. So lots of ways to get information about Big Sky Care Connect.
All right. Have a great rest of your day, guys.
Thank you.
Bye.
Thanks.